Out of nursing school, I started directly into the psychiatric field. And I enjoyed it. I felt that I had a knack for it, and I thought, this is what I want to do going forward. And being as I wanted to go back to school, it just made sense that I would specialize in psychiatry. We're trying to move back to the therapy role and the therapeutic role of nurse practitioners in psychiatry. The power of listening. You have two ears and one mouth, as they say. And listening to what the client has to say, their concerns, what are they hoping to get out of treatment? And then we try and tailor whatever plan of care around that, around their goals. When I meet a new patient for the first time, the most important thing is developing a relationship, building trust, know that they are safe in this environment, that they can talk about whatever they want without fear of judgment, without fear of their needs not being met, that ultimately their care and their well-being is our ultimate goal. That's part of my job as a clinician, to foster that therapeutic relationship in the therapeutic environment so that they feel they can be open and honest. The message that I would like each of my patients to understand is that they are not alone. There are a lot of people that are experiencing things that they've experienced. So, psychiatry, sometimes there's a stigma around it. And it's one of my goals is to get rid of that stigma, that there's a physiological basis behind these things that can be treated. It's the individual and uniqueness of every client. You can't rush these things. You have a patient come in, and it may sound like something initially that you've heard a dozen times. So you do need to take the time to take the history with the patient to understand what is actually going on. You get them on a treatment regimen that's been planned carefully, and it's been planned with good solid information from them and from their loved ones, and they become a new person. It's almost like a rebirth. And families will say, we have our loved one back, our son, our father, our sister, we have them back. This is how they used to be. And the patient will come back to you, and they're beaming. They'll say, this is amazing. I've been trying a number of different options for years, and this is the first time that something worked that I feel good and I feel better. And that's extremely rewarding. I'm Ethan Shipp. I'm a psychiatric nurse practitioner practicing at Intermountain Psychiatry and Counseling.